Hi! In this video, we will provide you with all the information you need to access the healthcare system in Sweden. Let's get started. First things first. In Sweden, the healthcare system is decentralized, which means that each region is in control of the healthcare system of its own territory. That's why, if you change municipality, you will find some differences in healthcare. The healthcare system consists of health, medical, and dental care. These three sectors are divided into both public and private sectors. For accessing the healthcare system, you will need to get your own personal number. Once you get your personal number, the municipality will send you a welcome letter and register you in the nearest health clinic, Vardcentral, where you can get treatment and help with non-emergency problems. Patients should be able to contact their local Vardcentral within 24 hours. After the initial examination, no patient should wait more than 90 days to see a specialist. If the waiting times exceed the 90 days, patients are entitled to seek for healthcare elsewhere with no additional costs, including travel. How to get a Swedish personal number? The personal identity number is obtained when a person enters the Swedish Population Register through the Swedish tax agency, Skatteverket. You need to have a personal identity number to apply for the Swedish ID card at the tax agency. Who can apply? International students who have a residence permit for at least 12 months or are admitted to studies for 13 months or more. Non-EU and EEA citizens who are employed in Sweden, earning at least 13,000 SEK before tax or 7,300 SEK net per month. Non-EU and EEA self-employed citizens with adequate funding to support themselves. Non-EU and EEA service provider citizens providing official documentation and with adequate funding to support themselves. Non-EU and EEA citizens who are moving to Sweden because of a family member. If you are moving to a family member who is already legally living in Sweden, you will need to provide the following when you go to your Skatteverket office. Proof that you are legally related to your family member in Sweden, such as a marriage certificate or birth certificate, and proof that you or your family member can financially support your staying. EU and EEA citizens. If you want to stay longer than 6 months, you will have to either be working and earning at least 13,000 SEK before tax or 7,300 SEK net per month, be looking for a job while having enough money to support yourself, or be a student at an approved institution. Asylum seekers or refugees. In this case, you will automatically get a LMA card. This card includes a temporary number, the coordination number, that allows access to healthcare. Once an application is accepted, it is then possible to apply for the personal number. Important numbers and access to online healthcare. If you have an emergency, call 112. The operator will probably ask you, what has happened? Where is help needed? Who is calling? What phone number are you calling from? And in case of injury or illness, what is the condition of the person injured? All emergency operators speak both English and Swedish and have interpreters available from Monday to Friday during the day. If it is not an emergency, you can call your Vardcentral, the Swedish police number 11414, 1177 for medical advice, and 11313 for information about non-acute accidents and emergencies. You can also access healthcare online, but you will always need your personal number. These apps are free and will provide you with a wide range of services through video conferencing or chat, such as prescriptions, medical advice, diagnosis, ordering tests, and mental health issues. Some of the most used apps and websites are KRY, Min Doctor, Doctor24, and Snap Doctor. Patient fees and costs. As stated before, each region is different, and this also applies to patient fees and costs. If you don't have a personal number or a European health insurance card, Then you must go to the emergency room and pay 2,500 SEK for your visit. Regarding ambulance or transportation, in some municipalities you will be charged for this, while in others you don't have to pay, or if you did, you will be refunded. All immigrants, refugees and asylum seekers have the right for an interpreter for no additional cost. Infectious diseases control. If there is a breakout of any disease or you would like to be protected against any future infectious diseases, you can contact the 1177 service, the World Health Organization, your local VARD Central, the SVA, or the Public Health Authority. Social services. Social services cover a wide range of health issues such as abuse, psychological problems, stress, trauma, mental illness, among others. You can seek for help from the social services in case any of these problems occur. In the case of children, depending on the issue, they are usually referred to a psychologist by a doctor at the VARD Central or by a school counselor or school nurse. In the case of asylum seekers or refugees, a psychologist always makes an initial assessment to find out about trauma, rape problems, crimes, and the general state of mind. From this assessment, asylum seekers or refugees can have access and be referred to a psychologist that can help them. If you have any of the previous issues, you can receive a referral from the VARD Central, call 1177, or the police. You can also speak with a psychologist at any of the free health apps available. If you are being abused or know someone being abused, you should contact one of the following entities. These are the basics of the Swedish healthcare system. We hope this video was useful and provided you with some insights on how to access healthcare in Sweden. Check out all the websites mentioned in the video for more information.